Hello, everyone. Welcome to you. And it's a pleasure for me to have you for today's peer support session. Let me just, I hope I have put up the correct slide deck. Let me make sure of that. Okay, so let me just change my screen and put up the correct slide deck. So warm welcome to our second peer support session. Today is the 14th of July, 2022. So if you don't have any sound, please make sure you look at the screen. I hope you're seeing to turn on your audio. And if you're having bandwidth issues, turn off. You can stop incoming video using the instructions here on the screen. And I'll be inviting you to raise your hand if you want to present your action plan today. But before turning towards you, today we are really going to be focusing on you sharing the work that you have already done as far as your IA 2030 action plan is concerned. Yes, because this is one of the most important deliverable of the course, because three of the certification requirements depend on it. You have to develop an action plan in order to carry out peer review, and in order also to revise and improve upon it, to submit a final version and expect certification for the course. So I'm just putting up the certification requirements as a reminder for us that to ensure that we do everything to go to the end of the course. I also shared the slides of yesterday's session in Telegram, and laying emphasis on how to join Peergrade and how to submit your action plan. So I've just shared the link, the Telegram link right now with you in the chat. You can go there to download the slides of yesterday, and from slide 10 to 18 you'll see instructions, even though I'm going to quickly go through them again during today's session. But I really want to focus, the most part of this session will really be focused on you presenting your action plan and receiving feedback from peers and from subject matter experts. And talking about a subject matter expert, I would just want to say a warm welcome to Anna Minter, that is right here with us in the room. We are going to be turning towards her when the time comes after you would have presented your action plan. And so I'll always start by asking you this question, because it is indispensable for you to move forward in the course. You need to join Peergrade, because the rest of the course will take place mostly on Peergrade. That is where you deposit, you submit your action plan. That is where you carry out peer review. That is where you see the comments that are left by peers on your action plan, and that is where you revise and submit the final version. So it's very important for you to ensure that you join Peergrade. And when I checked a few moments ago, 73 scholars had already joined Peergrade. That is about 60% of the participants in the course. So if you have not yet joined Peergrade, I'm going to invite you right now. If you're connected to your computer, follow these instructions with me now and join Peergrade. So the first thing is for you is to use the link and the code that I'm going to share in the chat. You click on the link and then you type the code. I'm going to share both of them in the chat for you right now. You click on the link and you type the code. So if it's your first time to use Peergrade, you need to create an account. So you click on create account. If it is not your first time, you already have an account on Peergrade, you click on login. Once you have done that, you will now move on to the next step. The next step will be for you to put in your full name, your email address, and a password that you remember. Make sure that the email address you put in is the same email that you used to apply for the course, and then you click on sign up. Now, if you're an existing user, put in your email address, put in your password, and click simply on login. If you don't remember your password, click on forgot password, follow the instructions, and so that you'll be able to get a new password. Now, once you have followed all of those instructions cleanly, you should be able to land on this page where you are asked to submit the initial version of your VPD surveillance action plan. So, but you can do so. You can join Peergrade even if you have not yet finished your action plan. But once you create your account on Peergrade, you join the course, you can now log out. If you log out and you want to log in again later on to submit your action plan, you then use this link that I'm going to share with you in the chat. you simply use this link. So you use the login link. Once you click on that link, you'll be requested to log in. That is, you put your email address and your password, and you'll be able to access Peergrade. So how do you submit your action plan in Peergrade? So once you are on Peergrade, you are on this page, you click on submit. Click on submit, and then another page will open. You will scroll down to the bottom of the page where you have to upload your action plan, which is a Word document that is saved somewhere on your computer. So you click there and you should access the document, the action plan on your computer, and upload it. Please make sure you upload the right document before you submit. So it should be your VPD surveillance action plan. And do not forget to click on submit. Do not forget to click on submit. Once you do so, you're going to see this page that is going to appear that shows that your submission is successful. And you should be able to see a preview of your action plan right here. So if you submit the wrong document, you will be able to see there and then that you've submitted the wrong document, and you can either click on change to change the document, or click on delete to delete it and resubmit the correct document. So always make sure that you cross-check that the document you submitted is the right one. So that is it in a few minutes, how you can join Peergrade to submit your IA 2030 action plan. So the next question I have for you, we are 22 participants in the room. Can you now answer this question in the chat? Have you submitted your action plan? Have you submitted your action plan? You can answer by a yes or a no in the chat. Answer by a yes or a no in the chat like I've just done. Please go ahead and respond. When I checked this morning, 24 persons have already submitted their action plan. So thank you, Melese. I'm seeing a no. So we did a poll this morning. And 32 participants were able to respond to the poll. I can just share my screen. We'll go now to Telegram. Let us see at what stage we are as far as the poll is concerned. That's very quickly. Okay, so we can take a look. Let me just admit those who are just joining right now. Okay, so here is the poll on Telegram. If you can see my screen, you see 37 people have actually taken the poll, and 43% have joined Peergrade. 30 will finish the action plan today. 8% have already finished, and 16% have already submitted. That is good. So we see that a good number of you are working on submitting today, and we have just about 3%, maybe just one or two persons that said they need help. And so if you are in this room and you need help, we are here to support you. Please try to type in your concern in the chat, and we'll be delighted to turn towards you to give you the support that you need. And just a quick reminder of what is expected of you for your VPD surveillance action plan is to identify your most important challenge, explain your VPD context, set a specific goal, and prioritize concrete actions that you need to carry out. And you have two key documents to do that. That is the rubric and the Word template. So right now, that said, I'm going to turn towards you in the room. And earlier on, we had Dr. Mohamed Bonos, who had volunteered to share his VPD surveillance action plan. So I'm inviting you, Dr. Mohamed, to unmute yourself. You've already done so. I'll stop sharing my screen so that you have the possibility to share yours. And while he is presenting, please make sure you can type in comments in the chat or question, and also prepare to give to share your thoughts on how he can improve upon his action plan. So over to you, Dr. Mohamed Bonos, and please feel free to please start by introducing yourself, telling us who you are and where you work. Over to you.
Thank you very much, Charlotte, for the opportunity. And I'll start by sharing my screen right away. So I see my screen.
Yes, we can see your screen.
Okay, thank you. Thank you very much, colleagues. Good morning, good afternoon, good evening. So the title of my piece is actions I will take that will make VDP surveillance in Taraba State, Nigeria, integrated and comprehensive. By the way, I'm a WHO surveillance officer with one of the regions in Nigeria called Taraba. Some of you that might know Nigeria very well. So my country of focus is Nigeria. My location is Taraba State, which is a region. My role and title is WHO State Surveillance Officer. My level in VDP surveillance obviously is the state or regional level. What do I do in my work in relation to VDP surveillance? I support the host government to plan and implement surveillance activities, including VDP surveillance. In this respect, we coordinate and implement technical activities directed towards surveillance of outbreaks, including those due to VDPs and health emergencies in the state. And we scale up the implementation of evidence-based interventions, facilitate policy and decision-making processes through improved health information coverage, analysis, and quality throughout the full cycle of the incident. Yes. What's my VDP surveillance challenge? It is how to provide a sustainable financing for a robust, comprehensive, and integrated surveillance system that has a sensitive and well-motivated and supervised reporting network at all levels, which is using real-time interoperable reporting platforms, which has easy access to optimized lab network and whose program decisions and strategy are evidence-based. So what is my VDP surveillance context? Disease surveillance in Nigeria, just like other African countries, is implemented in the context of the IDSR strategy, which links communities, health facilities, district, states, and the national level. In this context, there are surveillance structures and personnel or workforce at each of these levels. Community informants at the community level, AP surveillance persons at the facility level, DSNOs at the district LGA level, state epidemiologists, and national focal person for state and national levels respectively. Now, the community informants at the community level have no dedicated funding in the budgets, while at the health facility level, AP surveillance focal persons exist only in the AP focal sites, which make up less than 25% of the existing health facilities. The conduct of active surveillance is limited only to these facilities. These focal sites are also the only facilities that do regular, immediate, and weekly reporting to the next level. The remaining facilities, that is, which are referred to as non-focal sites, only send monthly IDSR data to the next level. Now, there are two approaches to information flow in the surveillance system. That the one that is indicator-based, which is structured reporting, and the event-based reporting, which is unstructured using community-based structures. Both of these approaches are augmented through supported supervisory visit from upper levels. It is instructive to note that the event-based reporting is a new concept and not well developed, and this has been responsible for late and incomplete reporting and sometimes missing of events and outbreaks. The well-functioning of the community-based surveillance component is critically important, as several settlements in my region are inaccessible due to security concerns and difficult terrain. Active surveillance and immediate weekly IDSR reporting is done only by focal persons in the focal sites. But at all the levels, surveillance for VDP and other diseases use the structures and ride on the back of and are integrated with polio surveillance and funded mainly through the GPEI fund for polio surveillance. And government is very reluctant to provide funding for surveillance field activities. There is minimal involvement of the private sector in VDP surveillance. But with the successful interruption of polio in Nigeria and Africa, this funding is dwindling, and this poses a risk for sustenance of VDP surveillance in my region. Now, what's the context related to the workforce? So in the context of the IDSR strategy, there are surveillance structures and personnel at each level, as mentioned earlier on. The community informants are ad hoc structures of the AP surveillance at the community level, which is not organized or streamlined, with no funding in the polio budget. At the same time, the well-functioning of the community-based surveillance component is critical to timely and complete reporting of events and outbreaks, as some of the settlements are inaccessible due to security concerns and difficult things. So if surveillance personnel cannot go to those areas, we should rely on community informants to report events to the health facilities. Now, at the facility level, AP surveillance persons exist only in the AP focal size, which I said is just 25% of the proportion of existing facilities. They conduct active surveillance for AP polio with limited functioning for other VDPs. Even though IDSR focal persons are designated in the non-focal health facilities, they are not funded, and their surveillance roles are limited to sending only routine monthly IDSR data. Some of the designated AP and IDSR focal persons are either temporary staff or volunteers, and so are ill-motivated and have low commitment. So there's a high, and there's also a high attrition rate among the trained surveillance personnel. One of the responsibilities of the state-level surveillance structure is supervision of surveillance activities at the lower levels. This function is rarely undertaken due to low capacity and lack of logistics. So in summary, we have a surveillance system or a network that is largely dependent on the polio structure and GPI funding, and it is unstructured at the community level, is fragmented and limited and ill-motivated at the facility level, and has there's limited conduct of supervision by the state to lower levels. Now, what is the context as related to the laboratory? So at the moment, my region is responding to outbreaks of VDP and other pathogenic outbreaks due to Lassa fever, cholera, monkeypox. Yes,
Dr. Mohammed, forgive me for
Yes.
interrupting you, but since we have a number of people that will want to present today, I'll just ask you, can you just summarize the laboratory part, the other segments, and then focus a little bit on the actions that your goal and the priority actions that you like to carry out?
Right. For the lab, testing, the rapid testings are done at all districts, while confirmatory tests are done in the reference lab. We have state pathology labs, which we need their capacity to be optimized so they can test more, they can confirm more pathogenic organisms to make the turnaround time less. And then the polio lab is only dedicated for polio. If that capacity can be also optimized for other pathogens, it will be very good. So in terms of information systems, currently the SOMAS platform is used by all the GSNOs at the district level. And this is, the problem is that most of them don't even input the data as required. So there's issue of the correct use of the SOMAS platform. About all health facilities are on the DHIS platform, but there is no interoperability between the SOMAS platform and the DHIS platform. So the critical challenge is is at the level of generation of the primary data at the community and health facility levels, where at the community level it is not well structured, and sometimes there is late and incomplete reporting, and at the facility level there may be data falsification. So, and sometimes there are limited internet access in some locations. Now, in terms of applied research, even though much research is not done at the local context, but program decisions and strategy are based on the national program directives and guidelines, which is sufficient for our context. So the issue of applied research is not very, very contextual in this case, and it's not a high priority for intervention. Sustainable finance, as said earlier, funding is GPI driven for polio, and polio is winding down, the funds are going down. So there's a threat to surveillance, but other sources of funding can be the Gavi funds. And then we have seen some private wealthy individuals have successfully funded and supported immunization programs. We look into that. Now, in terms of my goal is to fund the selection, training, and deployment of community informants to all settlements, train all surveillance actors on VDP surveillance, train and provide logistics for somebody supervision, procure electronic gadgets, provision of internet connectivity for access to real-time reporting platforms, and optimize state molecular lab and the public health lab to test for more bacterial and other pathogenic organisms. So, and the concrete actions to achieve, number one is to urge for signing of MOU, advocate for signing of MOU, Memorandum of Understanding for public-private partnerships. We are going to encourage the signing of the MOU between government and wealthy private individuals. This will be done at the state level. People we need is the government and wealthy individuals. And what will be the outcome? There will be available funds to the program for training and purchase of electronic gadgets and optimization of capacity of the state molecular lab. What's the risk to it? Reluctance of government or unwillingness of wealthy individuals to support. To avoid this risk is we are going to make advocacy and sensitization before we embark on it. Now, action 2 is also short term, selection and deployment of community informants to all settlements, which this will be at the community level. We need the community leaders and facility managers. The funding will be from the PPP if we are successful. This will build capacity of reporting network on VDP surveillance and increase sensitivity. It also builds capacity of upper level supervisors for supervision of to lower levels. The risk is if there is non-availability of resources and funding from the PPP, that's the risk. And action 3 will make advocacy for the inclusion of VDP surveillance activities on the Gavi action plan. We'll also make advocacy for optimization for the testing capacity of the state molecular lab and public health lab. And then action 4 is medium-term provision of electronic gadgets, computers, laptops for surveillance personnel to access real-time reporting on various platforms. Yeah, this is where I stop, and I intend to complete in the few hours to submit timely. Thank you, over and out.
Thank you very much, Dr. Mohamed Bonos, for that detailed VPD surveillance action plan. I see, before I turn to our SMEs, and Anilia and Anna Minta from WHO, I'd like to turn towards Melesi. I see your hand is raised. There is Aishatu Gubio, who is unmuted. Aishatu, I don't know if you have any comments or questions for Dr. Mohamed, or you unmuted yourself accidentally.
No, I unmuted myself accidentally, but it was a nice presentation. I was able to learn a lot of things from his presentation. Thank you very much, Mohamed, for that wonderful presentation.
Thank you. Thank you,
thank you so much, Mohamed. It was a nice presentation. We learned a lot of things from this.
Okay, please don't unmute yourself. If you want to speak for the sake of order, just raise your hand and you'll be invited to unmute. So I'm turning now towards Melese. Melese, please go ahead. You can also type your comments in the chat. If you want to give feedback to Mohamed's presentation, type your comments in the chat. And
thank you to give me the chance, Charlotte.
Yes, Melese, please go ahead.
Thank you, Dr. Mohamed. Thank you for your presentation. It is informative and I learned a lot. And also helpful to just finalize my action plan also. But I need something that I want to realize that, as you said, the main or the root cause of this all problems is the financial problems. If you get the financial resources, or if you fund it, how do you just think that your goal will be achieved if you always think that the reason that causes for this disintegration is the funding? It's really important also to think how we can use, how we can just integrate. So I think we need to see further how to integrate, how to just implement the activities. And also In your action plan, I try to see that there are points, bullet points that's listed. And it's good to include the a way or the mechanism that you are going to, or the methods that you are going to address your goal, so that to achieve your challenges. I think this is all my reflection. Thank you.
Okay, thank you so much, Melissa. Right now, I'm going to start with Anita, that has been with Anna Minta, that has been listening to the presentation from the beginning. Anna, do you have, what comments or feedback do you have to give to Dr. Mohamed Bonos for his action plan?
Great. Thank you so much, Dr. Mohamed, for your presentation. I am very impressed with how thorough your context is. It really provides the background that we need to understand the challenges that you're presenting and your plans for the future. So I thought that was a very good overview. I wanted to point out a few of the contexts that you mentioned to give some background and advice for the other participants too. So I appreciated that you did address all of the areas that are requested: the workforce, lab, information system, operational research, and sustainable financing. And as we could see from the presentation, usually, and also as your colleague pointed out, all of these things are interrelated. And so there's so many ways that we can improve the system. Sometimes it can be overwhelming. So I'm glad you were able to pick out a few things that you would like to focus on. So that was all very good. One other point I wanted to make is that for the sustainable financing, I thought it was very interesting that you mentioned wealthy individuals as a source of financing, because I think this is something I haven't heard mentioned very often so far. And it's an innovative idea. In a lot of the US and European countries, it's a lot of wealthy individuals who fund public health. It's good for their image, and it gets their name out there, and then they get more money. But I've found that in some of the African countries, the same culture isn't there. And so I think it would be very interesting to tap into those individuals, and especially in a place like Nigeria, they're some of the most wealthy people in the whole world. So if they could be tapped in to provide some funding, that could be very interesting. And then I also like that you put short-term, medium-term, long-term action plans. That's very important. And one feedback I had for you to consider is that, as your colleague mentioned, your focus is on sustainable financing, and the first short-term goal you have is to improve the community health worker, the support for them and their training and their ability to do surveillance, which is very important. But you mentioned that that's based on getting more funds, which is a longer-term goal. So I was curious if you could speak more or reflect more on kind of the order of that, if you'd be able to get funds short-term to do this, or if you think it might end up being a medium-term goal to increase the resources for the community health workers after you've been able to get the funds. So those are a few things to consider. And again, thank you very much. This is very well done.
Thank you, Anna. Yes, Dr. Mohamed, you want to respond immediately before I turn towards Aninia?
That's all right. Yes, thank you very much, Anna and colleagues, for the favorable review. And let me start from before backwards. And yes, when I was
just about the longer term and the short term.
Yeah, that's right. That's right. Yeah, when I said for the PPP longer term, it is something that is going to be pursued over a long time period, because the polio funding is fast running out. So, and that is what that will take the place of the polio funding. So by longer term, it means we start it immediately, we'll continue with sustain over a long period of time. Now, for the training could be done as soon as a PPP money is gotten, or as soon as we can redeploy some other polo funds to the training and the restructuring of the surveillance at the community level, because that is a very, very serious issue. If surveillance reporting is incomplete and late, it's a very, very big challenge. It's a gap that we really want to close very fast and move on that front.
Okay.
So that's what I want to say there.
Okay, thank you. Anidia, I know you joined midway, but any thoughts or comments to add to what Anna has already shared?
No, yes, thank you. Yes, I joined a little late, so I would defer what Anna has covered all, but this was an excellent presentation from the part that I saw, so I wouldn't be commenting right now. That would not be right. Over. Thank you.
Thank you so much, Anidia. And I see there is Hensa Hadush, whose hand is raised, wants to present their VPD surveillance action plan. Are you able to share your screen?
Yes, okay, let me.
Okay, let me stop. Okay, so please go ahead and do start by introducing yourself.
Okay. Okay, thank you so much for giving me the opportunity. I'm presenting the zero draft of my plan for your review and inputs from all colleagues. My topic is improve comprehensive vaccine preventable disease surveillance activities by building staff implementation capacity at national and subnational levels in Ethiopia. The country is Ethiopia, Addis Ababa. Specifically at Addis Ababa, I will target the Addis Ababa city administration or region. My current career is here, and I'm working surveillance activities as mentioned here. My vaccine preventable disease challenges the lower number of trained surveillance experts exacerbated by high staff turnover is affecting the effective vaccine preventable disease surveillance caused by early warning, detection and response in Addis Ababa. When I come to the context, shortage of trained and motivated workforce, inadequate financing for surveillance operations, and weak linkage among health facilities, district offices, regional and national level health emergency, the FEM systems, as well as immunization program coordination units are the main challenges to implement sustainable vaccine preventable surveillance activities. When I come to the detailed challenge, shortage of skilled workforce for surveillance, weak retention mechanism in place to motivate the health workforce, high staff turnover at all levels, preferably most of the time the lower level are also critical. There is also tracking mechanism for the trained personnel, lack of strong trainees database, post-training follow-up and resulting in adequate learning and skill transfer. High number of hard to reach areas geographically, there is a security issue, there is also a climatic issue. It's generally we can say the equity issue is there. So this is highly impeding the vaccine preventable disease surveillance in Ethiopia. When I come to the laboratory, we have a limited number of reference laboratories for testing. So samples are being transported for a long distance, and it's taking time. It's transporting by air if available, or by car, or by ambulance. So it's difficult to transport samples from the collection area to the reference laboratory. So shortage of reference laboratory, especially for the vaccine preventable disease targeted samples are critical. Shortage of lab supplies and the limited capacity of sample transportation are some of the challenges I identify in the laboratory. When I come to the information system, delay in feedback of test results, lack of timely data sharing, and data quality challenges are the information challenges that I identified. When I come to the applied research, limited capacity to conduct applied and operational research because of funding, lack of funding, or lack of skill, lack of insight to conduct operational research that can identify, that can generate an evidence for best implementation of vaccine preventable disease practices. The other one is also, when I come to the sustainable financing, shortage of resources for capacity building, staff retention, and program operation. So these are the challenges I identified. When I come to the goal to reduce the avoidable impacts of vaccine preventable disease by enhancing the implementation capacity and motivation of health workers on alert detection, response, and mitigation strategies using sound vaccine surveillance, vaccine preventable disease surveillance interventions. I also identified some draft core interventions action plan. The first action plan to conduct basic and refresher training to FEM officers and health extension workers in Addis Ababa. It's a short-term, organized comprehensive vaccine preventable disease training to newly recruited FEM officers. The second one is organized refresher training to those existing officers and train health extension workers on vaccine preventable disease surveillance. When I come to the level of implementation, it's regional, at district level, at health facility level, hospital, health center, and private health facility level part, firm officers, and the responsible health professionals will be trained. Responsible, I will be responsible. I should take the responsibility since I have been developed. The head of the FEM office, the FEM of the Addis Ababa Regional Health Bureau will be also the stakeholder, and health facility heads will be also engaged in to facilitate this issue. The other one is, oh, sorry.
Okay, so can you move to the second action?
Yeah, okay, I can move. It's hidden, I don't know why. The
down.
second action is advocacy to decision makers and development partners for conduct high-level advocacy to convince decision makers to allocate adequate resources for vaccine preventable surveillance, and conduct advocacy to development partners, both local and international NGOs, bilateral and multilateral and bilateral organizations to mobilize resources. This will be also done at regional and district levels. The regional level will be the high level, and the district level will be also to mobilize local resources. The third intervention is conduct monthly supportive supervision. Conduct monthly supportive supervision to monitor performance and learn lessons for further improvement in the area. This will be also done at district level and health facility level. This is what I have prepared for as a zero draft. I am working on it, so I will accept comments and additional input. Thank you.
Thank you so much, Hensa, for presenting your action plan to us. And remember, peers, that as from tomorrow, you'll be expected to give feedback. So you can start practicing on that right now. How can Hensa improve upon his VPD surveillance action plan? Please type your comments in the chat. And I'm also going to invite Anna Minta and Anidia to just hold their thoughts, take note of their thoughts concerning this, so that we'll listen to one more action plan. Since we are running out of time, we'll listen to Kabir, Yusuf, and then we are going to get feedback for both presenters. So I'm inviting Kabir, Yusuf. Are you able to unmute yourself?
Yes, I have muted myself.
Yeah, can you share your screen and introduce yourself, please? And then go
Okay,
ahead and
please.
present your action plan.
Okay, please.
While he's doing so, please feel free to share your thoughts in the chat, just your comments. If you have any questions for Hensa, we are going to come back to him afterwards. So type your questions in the chat. What feedback will you give to Hensa for his VPD surveillance action plan? Over to you, Kabir.
Okay, I'm trying to share. Are you seeing my screen?
Yes, can you zoom out a little bit more for it to be more clear?
Okay.
Okay,
Is it?
that's good. Thank you. Yeah.
It's okay. Okay.
Yeah.
Now, I title it as a re-immigration BPD surveillance, a new approach to doing things differently. Now, my country of focus is Nigeria. My location is Abuja. I'm a surveillance officer, and I'm working at the national level. What I do in relation to BPD surveillance is AAP and polio surveillance. Now, in summary, the main challenge that we are facing in regard to BPD surveillance is government support for active case search, tools for documentation, sensitization, training of surveillance staff is grossly inadequate or not at all. Now, do I go, you say, to my action point straight? Or do I read through?
Summarize your context and then go to the goal and the action steps. Just briefly summarize your context, please.
Okay, so this is the workforce, which can be subdivided into two broad groups. We have personnel at the operational level, which are mainly at the LGA level, and are called disease surveillance and notification officers. These are employees of the lowest government tier in the country and are the one close to the community. The DSNOs actively look for acute flaccid paralysis cases and other BPDs in the community and reporting sites, mostly at tertiary facilities where there is high probability of seeing an AAP case. Now, the second part of this workforce is the state epidemiologists and other members of the state technical teams, including partners. These are the second tier administrative level. They coordinate the surveillance activities and are mostly involved in investigations. The state staff, apart from partners, get funding support from partners. Government does not adequately support them for surveillance activities. And now we have the last batch of people that are involved in surveillance. These are community informants. They are domiciled in the communities and they report AAP cases and other vaccine-preventable diseases. Now, we have laboratories that are spread across the country. We have 2 folio laboratories that are situated in Maiduguri and Ibadan. We have 4 yellow fever and measles laboratories that are situated in Kaduna, Abuja, Gombe, and Lagos. And then we have 6 sentinel laboratories for bacterial meningitis and rotavirus sentinel surveys that are in Lagos, Benin, Enugu, Bauchi, Lorin, and Zaria. Now, most of the equipment and consumables that those laboratories need are supplied by WHO, and WHO also covers the running costs of these laboratories. Now, the type of specimen tested depends upon the laboratory and disease, ranging from stool and other specimens. Now, currently the country uses SOMAS and DHIS for VPD surveillance information system for all diseases. Laboratory staff do not have separate information system to input their data. All surveillance data are analyzed and feedback given weekly. Surveillance officers are different from those handling VPD surveillance data. And we normally report our data to WHO APRO, but there must be authorization from government before the data is shared. Now, research is seldom carried out to identify and document best practices. However, the use of innovative laboratory tests and diagnostics, new digital and mobile technologies for case detection and reporting, and novel procurement methods for laboratory reagents and other supplies are on the increase. Now, about sustainable financing, Nigeria Center for Disease Surveillance oversees VPD surveillance in the country. There's a dedicated budget from government for VPD surveillance in the country at all levels, though it's not adequate. So my goal is to have an integrated and robust surveillance system capable of detecting, reporting, and responding to disease outbreaks timely. Achieving this will certainly reduce the high morbidity and mortality the country is currently facing. So what are the actions that I have to achieve my goal? Now I have classified them into these short-term, medium, and long-term. So there will be advocacy visit to management authorities to solicit for more funding to conduct active case search, pre-position adequate data tools, provide funds for electronic reporting and timely investigation and response. This will cut across all the three tiers of government, that is national, state, and local government areas, down to facility levels where cases are seen and data is collected. Now, the people who are responsible are the surveillance focal persons at the national, state, and LGA, WHO, CDC, APINET, and other partners that are available. And their resources, not much resources are needed for this in the short term. The little resources available at each tier will be enough. But in the long term, more resources will be needed. So what will be the outcome of this strategy? There will be an increased reporting, investigation, and sportive supervision. Now, the risks, what are the risks if this is not done? There will be an increase in morbidity and mortality, and careful resource utilization will ensure that the risk is minimized. Now, action number 2 is capacity building of all surveillance staff. This will be conducted at the 3 government tiers. The persons, the leads are the surveillance focal persons at the national, state, and LGA levels, who CDC, APNET, and other partners that are available. Resources are needed to conduct the trainings and sensitization. Every aspect of the surveillance landscape will improve. That will be the outcome. And then what is the risks if this is not implemented? Just like what I stated in number 1. Now, number 3, provision of data tools, equipment, and laboratory consumables. This will happen immediately. That's a short term, medium, and long term. Data tools will be provided at all levels, while equipment and laboratory consumables will be provided at national level, at national and state levels. Now, the leads are as in number 1 and 2. Sorry, I didn't fill in the 2 columns. Over.
Okay, thank you so much, Kabir Yusuf. So we are still going to do like we did before, the same thing. Type in the chat any comments or questions you have for Kabir, because we have just 10 minutes left for this particular peer support session. And now I'm going to turn once again to Anindia for thoughts and comments and feedback regarding Kabir Yusuf's VPD Surveillance Action Plan.
Okay, thank you very much. First of all, I would like to congratulate all the presenters, all 3 of them. Although the first one I heard from maybe the second half of his presentation, they're excellent and very well thought out. Am I audible? Can I request everyone to mute, please?
Yes, please go ahead, Anindia.
Thank you. So very briefly, congratulations to you all. Very well thought out. I just wanted to make a few, not specific to anyone's presentation, but to make a few specific comments with 1 or 2 important caveats at the beginning. So the first thing that I'll say that by now we all understand, and the presenters have really gone into details to outline the challenges, and there is a lot of commonality in them, that it is sort of driven by or set up by surveillance systems still very much dependent on GPI resources. There's a concern about financing, there's concern about government ownership, etc., etc. These are all very valid. I would just focus on some potential possible solutions. And when I say this, please do not take this as WHO guidance. This is based on my experience in several countries. So what I say is not a dictum that you have to follow. These are just suggestions. I'm sharing my experience, how some of these problems can be solved. Also keep in mind that if I suggest these solutions, these are not panacea that everything will be applicable everywhere. Perhaps none of these will be applicable in your country, or some will. So you pick and choose and see what you can fit. My first suggestion is that there are many problems as you have outlined. One way to do it is it's like a game, like a soccer or a football game. You first analyze who are the players in the field. That means there are different donors, there are government, different donors have their different interests. Somebody may be interested, say, in vaccine introduction. Others may be interested in measles control, maybe polio control, maybe other diseases, even TB control or other things. So if you have that and you have a resource constraint, by you, I mean the presenter here, whichever organization you're coming from, what some countries have done, and this is not theoretical, this has actually been practiced, they have taken the TORs of the basic surveillance stuff, and what was exclusively polio first, they have added a little bit of measles surveillance, a little bit of immunization, saying that they will devote 30% of their time for measles, 30% for polio, 30% for immunization, and 10% for other control, etc. And then gone back to the donors and the government and used the government, I will come to the government angle later, and said, look, we are ready to do this. We are ready to support you with this. Can we get maybe 30% of our funds from this support for our work? So that could be one solution. Again, it will not work everywhere or in all countries. The second point that I'd like to highlight is not in a span of one day, but when you present these cases, you also present your data, that what are the gaps in surveillance, operational data, gaps in the sample transport, delays in sample transport, maybe with polio, maybe with others, and make it evident to them that if you withdraw your support or do not support this surveillance is going to fail, and then you meaning the government and others, you will get your data late or imperfect data, which nobody wants. The third point is try to have the government on your side, because all national governments generally want public health impact and want to cut down on communicable diseases and other things. And there are majorly two ways that the government can help you. One is the ideal way that the government puts in money. Some countries, they have actually done so. They have completely taken over most of the WHO funding, and if the government has the money, they have done it, which is ideal. But most countries, this will not perhaps be feasible. The other way is to request the government to do two things. One is introduce a small token budget line in your budget, in the health budget on surveillance. This may cover even 5% or 10% of the total cost for VPD surveillance. Doesn't matter. As soon as they put that in, then use their voice, the government's voice with the donors. And let me tell you one thing from my experience, WHO's voice or UNICEF's voice or CDC's voice, if I put a score of 1 to 10, would be 1 or 2, but one sentence from the government will have a score of 9 to 10 to the donors. Yes, if the government says this surveillance is important for me, I have put in 10%, you give me 90% of this budget to do this because this is my priority. That speaks very loudly. So that line item in the budget, and use the government's voice either in advocating to the donor. The next point I would like to highlight, also think of building up collaborative teams within WHO. Also, we work in silos. VPD doesn't talk to WHO or others. Also beyond WHO. That means there can be other teams who are working, other implementing partners, and sometimes a formal system of communication and coordination helps. And I shall end with saying one thing, that depending on your level, your plan will focus more. If you're at a subnational level, maybe you'll have to focus more on the operational issues, like someone raised the problem with DHIS2 and SORMAS, and someone also suggested the solutions for flat tables. Maybe you need to explain what the flat tables are to everybody. So those are the more operational issues. Whereas if you're doing a national level planning, you'd be focused on the more on the advocacy and the administrative and the political ownerships, the other issues. Nothing is small, nothing is big. It is only according to the level that they gain importance of more or less, our relevance to the plan. So I will stop here. Maybe I hope I made some sense, just to suggest some ways that the problems can be solved, and may not be a perfect solution for each and every country or each and every situation. Over for me. Thank you.
Thank you so much, Anindya. And I just echo the appreciation of Hensa, Hadusha in the chat as well. So I think I'm going to end with Anna Minta. Any additional feedback for our two presenters, Hensa and Kabir?
Yes, thank you so much, Hensa and Kabir. You've done a very good job for both of your presentations. I appreciated the context. I like that you put in the action plans, the different short-term, long-term, medium-term. And just to add maybe two things to what Anindya said, one thing I appreciated too was for the action plan, for Hensa, you mentioned you put yourself as a person who's responsible to take these actions. And it may be implied or not in of the other people's action plans, but I thought it was really good and a show of how you've kind of internalized the strategy that you are looking for things that you can do to change the surveillance system. And as has been mentioned, we know there's so many issues. There's a lot of things that are outside of each of our hands, especially several of the presenters mentioned things like insecurity, difficulty getting to certain areas. There might not be anything that we as individuals can do, but there are a lot of things that you can do, and you've mentioned some of those. So that was really helpful. I also appreciated that you talked about local NGOs. That's another way to improve country ownership. In addition to the government, which has been mentioned with very good ways in India mentioned to increase participation from the government, also including local NGOs makes this more community driven, which is part of the strategy as well. And then for Kabir, I also wanted to mention, yes, I appreciate your detailed context. The advocacy visit, I thought was a good idea, and India has given some suggestions for specifics you can put in there to make it more likely to succeed. And then this is general because I've noticed it in a couple of the risk sections for the presentations, not just for one of you, but several of you, is you can include also some short-term risks. And just as an example for the advocacy visit, one of the short-term risks could be that the government may not be interested or may not have time. So then that's the reason why you're coming in with this very detailed. You're going to bring the data, you're going to explain to them what will happen if they don't support, like in India mentioned. So I know we're at time, so I'll just stop there. But again, thank you all for presenting. Very good job. And thank you also to those who provided feedback to your colleagues in the chat. Thank you.
Thank you so much, Anna. Thank you, Anindia, for the comments and the feedback that I'm sure is not only going to help Kabir and Hensa, but also all of the other scholars in the room that are still working on their VPD surveillance action plan. So I'm just going to stop sharing Kabir's screen, and then I'll go back. And I'm sorry, we have gone a little bit over the time for today's session, but I thought that it was really important for us to focus on the action plan presentation. So I'm just going to take a few minutes to run us through a couple of slides on peer review, because as from midnight today, that is as from tomorrow, Friday, Peergrade will be open for you to carry out peer review. And the 3 peer reviews you're supposed to do are due at 11:59 p.m. on Monday, the 18th of July. That is Geneva time. So just to say, we cannot overemphasize the importance of peer review. Like we said, we have said it from the start of this course, some people may not be able to complete the course if they don't get your feedback. So it's very important. And you also may not complete the course if you don't get feedback from peers. And that feedback has to be constructive, it has to be useful, it has to be in a way, comments that you are given have to be in the way that you would like to receive those comments themselves. And we'll talk, go into more details on that during tomorrow's peer support session. So on Peergrade, for those who want to get a head start, before we meet tomorrow for our peer support session, is for you to start peer review on Peergrade. The first thing you have to log in, and you will use this link that I already shared before. So if when you want to submit your action plan, you still need to, you have to log in using the link that I've just put in the chat. And then you select the VPD Surveillance Action Plan initial version. Now, for those who have already submitted their action plan, if you log into Peergrade, this is how your page looks like. You have no upcoming task right now. But as from Monday, you need to go to as from tomorrow, sorry, when you log into Peergrade, you're going to see this. Don't forget the other details. I used the page from a different course, but you have to see this icon that is asking you to give feedback for the initial version VPD Surveillance Action Plan. So you click on give feedback. Once you click on that, you'll be taken now to Peergrade. On the right-hand side, on the left-hand side, you will see the work that the peer, that is the action plan that you have to review. And on the left-hand side, you will see the instructions on how you are going to do the peer review. So for each of the 3 submissions, you need to give feedback to the author with respect to the specific criteria. You will first give a numerical rating, that is to assess the author's current level of work for each criterion, and then you need to explain your rating using the additional comments required. So this is what it looks like on Peergrade. So you carefully read the peer's work. When you go, you'll see that I'm going to show you, you have received 3 submissions, but the first one will be the submission 1, and submission 2 and 3 will only open after you have submitted the feedback for submission 1 for the peers first action plan. And we are going to do this practically tomorrow. So you see here, you choose a rating and you explain your rating by giving concrete and specific suggestion on how the peer is going to improve upon their work. And of course, you are going to use the rubric. The rubric has some comments and questions on the yellow boxes that are for you, who is the reviewer, to help you to give the peer constructive and very useful feedback. So once you have done, you have to scroll right down to the bottom, giving the comments for each of the sections of the action plan. And once you are through, you click on submit feedback. So once you click on submit feedback, the second work is going to automatically automatically be open to have access on the second action plan that you start the review all over, and at the end also click on submit. So that is it. And I'm telling you, join us tomorrow for tomorrow's peer support session. If you want to be able to practically, for those who are ready to start peer review, one person can volunteer to share their screen and demonstrate the peer review process. But basically it is straightforward, just as you have seen. Now I'm officially the session is over, but I'm going to stay connected for another 10 minutes to help anyone that has any other technical issues. If you're having concerns with joining Peergrade or accessing, submitting your work on Peergrade, logging in, whatever issue you may have, I'm going to invite you right now to raise your hand, and I'll stay in the room to give you the support. And for those who have to go back to working, to work, to your other duties, please feel free to leave the room. And thank you so much, Anidia, for your presence today and for the very useful comments and guidance that you gave to the peers as our guide on the side alongside Anna Minta. So you're free to leave the room, but if you have any challenge, stay back, raise your hand, and I'll turn towards you to share your challenge with us, or you can ask your question in the chat. And if there are no challenges or concerns, no problem. We can then separate and make it a date tomorrow. But before then, I'm going to share with you the instructions that I shared earlier on in the session on how to join Peergrade and submit your action plan. I'm going to paste those instructions right now in the chat again for you, so that you may, if you have not yet done so, you have not yet joined Peergrade, you have the opportunity to do so right now. So far, I'm not seeing any raised hands, and I'm not seeing any concerns in the chat. So I consider that all of us, we are working towards meeting the deadline, which is in under 12 hours. It's in about 11 hours, the deadline to submitting our VPD surveillance action plan. So I just want to wish you all, good luck as you elaborate, as you work on your VPD surveillance action plan, and I do hope you all make the deadline. Mesha, I shared this particular slide deck in the chat earlier on. I'm just going to put it up again. I'm going to put it up for you. If you want, you can download the slide deck right away. It's about a little over 7 megabytes. So it's taking a few moments to upload, but you should be able to download it in the chat, and I will also share it on Telegram after the session, and it will also be uploaded in the course resource folder. So once again, everyone, thank you for your active participation, and I'm looking forward to more volunteers tomorrow who will share, if you start, how they are going to their action plan, and also the peer review process. So Mesha, just a little bit of patience, and while the slide deck for today is being uploaded in the chat. Okay, so I'm going to leave that in the chat for a few moments before I close the session for today. And thanks again, thanks everyone. Thanks, I want to say Mohammed, our presenters for the day. We have Mohammed, we have Hensa, and we have Kabir. Thank you for volunteering to present your work, and thanks to the peers that gave their feedback in the chat, and also to our SMEs that were our guides on the side. And I look forward to seeing you tomorrow at 11 a.m. Geneva time, hoping that everyone is going to make the deadline to submit their VPD surveillance action plan, because your continuing the course depends on that. So I wish you an excellent day, excellent evening, excellent night, depending on where you're connecting from, and see you tomorrow. Bye for now.